Hi, good evening. So tonight's presentation is in response to a email written request that I had to do a talk on ankylosing spondylitis because there wasn't very much in our favorite resources yet on this very important topic. So going back to nutritionfacts.org, there's one presentation having to do with turmeric, which is one of the best spices for fighting inflammation. Hands down. Although I'm sure there'll be more as the research comes out on this. So the thing that makes ankylosing spondylitis a little bit easy to talk about in the sense of how do you take care of and reduce the inflammation and so forth is because it falls in the family of general autoimmune problems. And so the arthritis reversal elimination diet that Dr. Barnard has in the Physicians Committee for Responsible Medicine website, pcrm.org, or nutritionmd.org, basically is a very universal process. And so it works for a number of different kinds of inflammation. I've actually had a few folks in the clinic with ankylosing spondylitis that did try the elimination diet and have found some success. Now, everybody is a little bit different, and every disease is a little bit different as well. And so some of the features of ankylosing spondylitis basically are that it has to do with inflammation, generally speaking, mostly along the spine, especially the lower part of the spine. So some of the signs and symptoms of it, basically, if you're able to step back and put your back against the wall, sometimes when people have an advanced case of ankylosing spondylitis, their body kind of fuses in a way that leaves them a little bit with a hunchback posture and the head is forward. One of the key reasons to make note of this in the early stages is to try to help prevent some of the possibly permanent deformities by engaging in some early physical therapy, posture exercise, things like that. So if you want a quick posture exercise, please check out my posture exercise video. It's only about 8 minutes long, and it's a good thing to practice for anybody that has concerns about forward flexion, which is almost all of us that get a slouching posture over time. So some of the signs and symptoms of ankylosing spondylitis, fatigue and sleeplessness. So one of the troubles with inflammatory arthritis of all flavors is there's a tendency for these things to be very active in the evening time when you're trying to sleep. So some folks with this wake up in the middle of the night, especially the second half of the night, after they've spent the first half lying down and relaxing and basically attempting to get some good nights of rest. So when the body wakes up in pain, it can be very distressing, and it's one of the reasons why people end up not just with the pain of the disease, but also secondary mental effects such as trouble concentrating and anxiety and other related things, plus just the effects of having chronic pain on the body. So rates of anxiety and depression tend to be a little bit higher in folks just for these very basic human reasons, that when we don't get enough rest, then also because of the inflammation itself. So when the body is under attack, so to say, in other words, the immune system is riled up and getting all of its defenses going and attacking at full force, well, people sometimes feel kind of like they got the flu. They can get fevers and chills and just that general kind of malaise that goes along with the body triggering its immune system response. And so that is one of the things that can account for all of this. And there's also a really neat new model of depression where it shows that the brain itself, when it's got all this inflammation going on, tends to be a little bit more subdued, tends to want to cause people to hide under the blankets, for example, and other things that we'd associate with kind of sick behaviors or depression kind of behaviors as well. Arthritis of the hips is pretty common in folks with ankylosing spondylitis and can cause pain in the groin or in the buttocks, and sometimes can cause to have some trouble walking, especially when the inflammation is going on. And surprisingly, the heels and the shoulders can also get involved as well. So basically, the area of the body that is troubled by this disease tends to be kind of along we call the axial spine, so neck, upper back, lower back, and on down. And so the heel or the bottom of the foot, so plantar fasciitis as well as Achilles tendonitis, those things can also be inflamed along with the rest of the up and down areas as well. So occasionally other joints can get affected, so just like with psoriatic arthritis or lupus or rheumatoid arthritis, pretty much any of the joints in the body can be affected as well. One of the key things that makes it a little bit easier to look for the ankylosing spondylitis is that when people have the rheumatoid or lupus or Sjogren's or some of these other flavors and varieties of arthritis, they tend to not get arthritis in the spine, like in the lower back, as much as the people with the ankylosing spondylitis. So that is one early sign that can make it a little bit easier to diagnose it. So basically make the diagnosis with a bunch of different kinds of things. We'll take x-rays. There's a kind of a characteristic look, like a bamboo spine looking on the x-ray. You can check it out on the resources afterwards if you like. And sometimes we use MRI, sometimes some fancier kinds of x-rays like a CT scan. And so the idea is that in folks that are having some of these characteristic patterns, like for example, the pain is almost always located in the lower back and begins in early adulthood, before age 45 for the most part, a very gradual onset and worsening of the back pain over time, rather than a acute or sudden injury. So many kinds of back pain, we have a little bit of a knowledge of, okay, I did this and then my back was hurting. And in the case of ankylosing spondylitis, because it's a inflammation that's going on deep in the spine, it doesn't just show up overnight. It kind of gradually gets in, and it lasts for longer than 3 months. Another characteristic of the ankylosing spondylitis is it's worse after resting. So in other words, like the other arthritis that kind of whenever the body is not moving, the inflammation tends to kind of sit and gather in those joints. Same thing goes with ankylosing spondylitis. And so it's very common with any inflammatory arthritis that first thing in the morning, that joint stiffness and you don't really want to move, and it takes a little while of moving in order for the joints to be a little bit liberated and actually be able to move a little bit more. So improving with activity. So if you are curious and want to check out some very easy exercises that just kind of move through all the joints in a very systematic manner, there's a playlist of joints and glands exercises that I recorded a while ago that can be done both sitting as well as standing, depending on level of energy and level of ability to be able to get up and move. But I found that kind of exercise to be very, very helpful for days when the arthritis is kicking in, and also to help prevent that stiffness from setting in quite as much. So improving activity is a key point with ankylosing spondylitis. The pain from this kind of thing, again, tends to wake people up in the second half of the evening. So after that first few hours of rest, then as the joint in the spine just kind of sits there and then finally it gets so inflamed that it triggers that pain, it wakes people up in the middle of the night. And also there can be some buttock pain associated with as well. So there's a lot of nerves and a lot of tissues that are down there, and people can get pain in either the right or the left side of the buttocks, and that pain can be alternating as well. So with all of this, The things that can be really useful for taking care of the ankylosing spondylitis is very similar to all of the other ones, the other arthritises, that is. So taking good care of yourself. There's a wonderful model of activity called the spoon theory. So for those who've not heard of this, the idea is that you're granted 10 spoons in the morning, and the spoons represent the level of energy that it takes to do a particular task. So maybe regular folk that aren't suffering from arthritis, in their basket they've got maybe, I don't know, let's just call it 50 spoons just to make a comparison. Obviously this is just analogies, so everybody's going to be a little different. So if your friend has 50 spoons in their pouch and you've got about 10 spoons in your pouch, well, getting up in the morning and making breakfast and packing the kids' lunch, maybe that's a lot of energy and expense for you. And so you give one spoon, basically to say, all right, to represent that is a fair amount of work. And maybe doing the dishes is doing another spoon. And maybe going to work and working for 6 hours is another spoon. So generally speaking, by the end of your 10 spoons, you're pert and you're tuckered out and you're tired, and the body needs to be able to rest and recoup and recover. Whereas your friend who's got 50 spoons, well, they do all of that and they've got plenty of energy left over, and they're looking at you like, wait, why are you turning in so easy? Why are you not going out for this extra activity or whatever the thing is? And in terms of the arthritises, the spoons metaphor can be very helpful to help to explain to other folks around you basically why it is that you're self-modulating activities. So there's a balance between doing too much and too little. And somewhere in there, and everybody on a day-to-day basis finds their own way of coping, but it can be very helpful when somebody is basically under one of these arthritises, and to be very self-aware and be able to tell when you're crossing that threshold from, all right, I'm at my 9.5 spoon, I'm about to approach my 10th spoon, maybe it's about time to just crash and rest for a while and let the dishes sit down for a little bit longer, that sort of thing. And being able to explain that to other folks can be a benefit, because maybe someone else can help you out with some of these activities of daily living or other projects, or just simply give you a little bit of space and understand that not every day is going to be a 10-spoon day kind of thing. So activity modulation can be very, very helpful. Physical therapy kinds of things can be extremely helpful for folks with this condition, because this is one of those conditions that, if not tended to, can change the posture, can change the curvature of the spine, and being very mindful to keep the spine in proper alignment can make a big difference on issues later on, especially when the flexibility starts to go down a little bit. So ankylosing spondylitis, this is one of those diseases that's actually more common in men than women. Very rare for arthritises to be found in men, compared to when most of the autoimmune diseases that are out there tend to be female-focused for some reason or another. And basically it can affect every aspect of life, so rising from a chair, getting dressed, if you're on the floor, getting up from the floor, standing for long periods, climbing, looking to the side or looking over your shoulder when the joints of the spine are stiff and troubled, and then some of these things that we really take for granted can become more difficult than usual when it's not really well controlled. And basically the same sort of thing with other just regular household chores and things. So the more that a person's family members understand what's going on with them and realize, oh, they're not just being lazy, they really can't use the vacuum, today, can be very, very helpful for keeping peace in the household and all. And The most common time for people to be diagnosed with this, along with the other arthritis, is around between age 20 and age 30 or so. So it does tend to strike the young, certainly usually before age 45. Although, because there are many other things that can cause back pain, sometimes it can take a while before the diagnosis is actually uncovered. And just because many things that go along with back pain mimic other things, and certainly people with back pain can also have troubles with their tendons lower down, like their feet and their Achilles tendons as well. So there's a whole bunch of different kinds of things that would be useful to talk with a physician, getting blood work, getting tests done, talking about the impact of how to take care of yourself, doing physical therapy things to keep the spine straight. And the elimination diet that's mentioned for the other arthritises can be very, very, very helpful, especially in those early stages when the diagnosis is still fresh and before the disease-modifying drugs that are commonly used by the rheumatoid arthritis doctors, the rheumatologists, like to prescribe. And it's very easy. If you check out my video on arthritis or controlling the immune system, there's a twofold approach to it. Basically, putting on different kinds of foods and other kind of techniques that help to control the immune system and make the immune system more under your control and less, oh surprise, there it goes again, kind of stuff. And also at the same time, removing the triggers for the immune system as best as possible. So some triggers you can never completely avoid. For example, exposure to a virus can trigger anybody's immune system, especially if you got an autoimmune condition. Life is going to have some ups and downs, so life stressors can trigger it. Weather occasionally can trigger it. So when a storm comes through, yes, it's true, many people can feel it in their joints because something to do with the pressure actually can affect the joints and cause swelling and things. But one of those things is figuring out all these different kinds of things that are within your locus of control. So what can you control? You can control what kind of things go into your body. You can control how you learn to react to stress, and also meditation, learning different kinds of things about yourself and being self-aware and realizing when you might be accidentally overdoing it and learning how to step back and learning how to ask for help. These are very important kinds of things that can be useful for anybody with a chronic painful illness, but especially in those with the arthritises. So please also check out my video on learning how to control the immune system, because things that are part of the fire blanket include turmeric, a quarter teaspoon 2 to 3 times a day, and with active inflammation, highly recommend leaning on the 2 to 3 times a day. Work your way up to that, because if you do 3 times a day, you might get some diarrhea. So it's one of those things to kind of work towards. And there's a whole bunch of other foods that are especially good at helping the body to suppress the excess inflammation. Dr. Barnard has a beautiful book entitled Foods That Fight Pain. It's a penny on Amazon, and it's a great summary of some of those things. And it's also got a great summary of the approach to using this simple elimination diet to help control symptoms. So the idea with it is that eliminating the most common triggers for about 4 to 6 weeks while working on yourself in terms of deepening relaxation practices, basic meditation practices, stress management, working on regulating the amount of energy that you put out in particular things, learning where you can ask for help, and all that kind of stuff. And after about 4 to 6 weeks, if the immune system is responding well to this, the level of pain will go down, the amount of energy will definitely go up, and people just overall feel better. Does that mean that you won't necessarily need medications? Of course not. Everybody's a little bit different. Things like steroids, things like some of these other medications, especially when working a busy job and other life events can be very necessary at times. And so that's, again, one of the reasons why these videos are educational only, and for you to talk with your own personal physician. So I hope this gives a little bit more of an understanding of ankylosing spondylitis. So, basically keeping an eye on things can be very helpful. There's a few other suggestions on this review article that can be helpful too. Just watching out for things such as watching out for the amount of alcohol and drugs, such as narcotics. When dealing with chronic pain, it can be very easy to reach for the narcotics and other things and become addicted to them. And sleeping pills and things like that should also be used cautiously, partly because when you're taking a sleeping pill and then you get up in the middle of the night to go pee, your risk of falling is much, much higher. And plus, some of these things can also be troublesome. Because when the spine becomes fused and does not move as well as usual, that flexibility is really key to the spine's health. It's kind of designed to move. And if it's fused and if it doesn't move very well, then it's much more likely to accidentally fracture, especially at later stages of this, when the spine becomes a little bit more, the bones are a little bit weaker later on. So even minor falls or accidents in the advanced stages, such as minor car accidents or just plain old slipping in the tub, those kinds of things where a regular person might bounce back and not having trouble from it, somebody with this disease for a while, especially if they've had steroids and other things that, in addition to the disease itself, tend to thin the spine, they might end up with a spinal fracture or some other serious injury as a result of something that's a little bit more minor for other folks. So watching out for alcohol, just making some modifications to the home to just decrease the risk of falling in general. So grab bars in the tub, night lights, watching out for loose rugs, those tend to trip up people. And keeping places just free of clutter, so no electrical cords and other things to trip over on there. Seat belts, of course, are vitally important, should be worn at all times. And if you're having trouble with neck flexibility and being able to look behind you, then having a large mirror for the top of the car, for the rearview mirror, can be helpful because it allows for a better range of being able to see around you if you're having trouble with turning the neck and such. So anyway, I don't want to go too long tonight, but there is a couple other things that can happen just as with any of the other autoimmune diseases. Sometimes when the body gets a taste of fighting off its own body, then sometimes a few other things do tend to kind of go along for the ride. So uveitis, basically inflammation of the eye, is a very, very common issue with ankylosing spondylitis. And it can cause pain in the eye and blurry vision and sensitivity to the light. We mentioned the spinal fractures and spinal cord injuries, and then other nerve issues. So there's a syndrome where the nerves that lead to the legs get impaired, called cauda equina, because that happens when the nerves get damaged in the lower back. Heart disease. Now, heart disease can be common in any arthritis because of the higher inflammation throughout the whole body. But in particular, there is a leaking aortic valve that can happen pretty commonly, and sometimes that can cause the symptoms of heart failure. So in other words, swelling in the feet and trouble with shortness of breath during exercise. So if you have ankylosing spondylitis, make sure you're talking to your doctor and make sure they're actually listening closely to the heart. Sometimes people can get echoes or an ultrasound to keep an eye on things as well. So sometimes they need surgery, sometimes other medications to regulate that. And then also, because the joints of the spine link up to the ribs, and breathing is very important, for all of us. But when folks have increasing stiffness in all of those, what we call axial joints, the joints up and down along the spine, sometimes it can be difficult for them to take good deep breaths and to really expand that chest wall for exercise or for other things. And so that can probably cause issues with being able to expand the lungs. And if you can't expand the lungs properly, sometimes the bottom part of the lungs kind of collapses a little bit. We call that atelectasis, and that actually can happen to anybody that gets sick for a while. For example, people who are in the hospital after surgery, they actually give them little devices. I actually still have one over here, where you can actually practice breathing into it. And so as you can see, these little things kind of go up and down. So when you basically are playing with devices such as this, so there's another one that you blow into it and it gives some resistance. These kinds of things are very helpful after surgery to help keep those lungs expanded and prevent complications such as pneumonia that can happen when the lungs are kind of collapsed. Or if there's fluid in the lungs, it kind of helps pop them open a little bit to be helpful. And finally, some folks get trouble with the bowel. Sometimes there could be ulcerations along the bowel, which doesn't necessarily cause symptoms, but just something else to be aware of that could be happening with there. So anyway, I do encourage you to check out my other video because, again, rather than rehashing all of the elimination diet in this one video, and just to say there's a lot of overlap between the different flavors of arthritis that are out there. The details of each one are going to be a little bit different, and everybody's individual story and everybody's individual treatment plan, of course, are going to be personalized. So thank you for the question, and I hope that this answers it a little bit for you, and have a good rest of your evening. Thank you for watching. Till next time. Bye-bye.